Hello, my name is Dakota Taylor, and today I will be presenting on bipolar disorder. So, bipolar disorder is a mental health disorder that is characterized by cycles of extreme highs and extreme lows. The extreme highs are called mania or hypomanic episodes, and the extreme lows are called depression or depressive episodes. These cycles can happen one after the other, they can have breaks in between, or there can be periods of mania that are not followed by periods of depression. These cycles can occur very often, every few months, or they can occur only once or twice a year. This disorder was previously named manic depressive disorder after the manic episodes followed that by the depressive episodes, and has recently been renamed bipolar disorder, bi meaning two, with mania being one of the two stages and depression being the second of the two stages. Although it's been really popular in the media over the past 5 and 10 years, it's very rare, and less than 1% of the Canadian population currently experiences bipolar disorder. In order to be diagnosed with bipolar disorder, an individual must be referred to a psychiatrist and work with that psychiatrist to go through a psychiatric workup, in which at that point a psychiatrist can choose to diagnose or not diagnose the client with bipolar. Other common mental health disorders that are similar that may be an alternate diagnosis is severe anxiety or severe depression. Bipolar is more rare than either of those two. This is a dangerous disorder, and individuals can be hospitalized at times of mania in particular. Due to the feeling of invincibility, they may engage in very unsafe activities that put their life at risk or put their health at risk, such as unsafe sex, excessive partying, and use of recreational drugs, or fast driving, anything that could be characterized as dangerous or life-threatening. There's no cure for bipolar disorder, but it can be regulated with medication. So, manic episodes are one of the stages of bipolar, and this can be characterized by feelings, like I said, of invincibility, excess euphoria, which would be excess excitement. Excess meaning not being excited necessarily over things that warrant excitement, but being overly excited by things that would not regularly excite people, or having hysteria, laughing at things that are not funny. Inability, essentially, to have regular reactions to activities. It can also be characterized by irritability. This can cause the making of rash decisions, and like I said, can lead to hospitalization. During manic episodes, people can struggle with sleep, irregular eating, sleep particularly, and sleeplessness, because they have excess energy, not feeling the need to sleep or want to sleep, and these individuals could stay up for days at a time, could lose interest in eating as they have so much excess energy and are excited by other external factors other than eating. And they can struggle to maintain day-to-day activities, or can struggle with jobs, acting out at work, losing their jobs, or not prioritizing work. Manic episodes can be followed by depressive episodes, and these can be characterized by stopping engaging in things that the individual maybe once enjoyed. They could stop showing up for work, they may become antisocial and disengage from friends or romantic relationships, and they may miss things such as appointments or scheduled shifts at work. Good to note that depressive episodes don't always follow manic episodes. There can be spells in between the two, and there are different types of bipolar that I will talk about that can lead to different patterns for depressive episodes. These individuals may be always tired or always sleeping, and they could be resigned noticeably from interests, hobbies, friendships during these times. Some common symptoms of bipolar include the inability to hold down jobs, or the individual may switch career paths often or find their interests, hobbies change. They may be super active and then be super engaged in video games, or two things that are very, very different from each other, and they may be gung-ho for one or the other. They struggle to maintain healthy relationships as their moods are very unstable and maybe their interests change often, so their interest in people and partnerships may also fluctuate quite frequently. They can struggle to carry out daily functions such as like a regular sleep hygiene schedule, a regular eating schedule. Regular hygiene may not be a priority during depressive episodes or may be forgotten during manic episodes. So there are 4 subcategories of bipolar, and they are bipolar 1, 2, cyclothymic bipolar, and mixed bipolar. Bipolar 1 is the classic form of bipolar. It is characterized by the most regular severe mania and severe depression, kind of equal. It would look like equal ups and downs, essentially. During manic episodes in bipolar 1, there may be psychotic breaks. It may be so severe that they are hospitalized and they break from reality completely. These cycles can occur over months or years for bipolar 1. Bipolar 2 is somewhat similar to bipolar 1, but there are less severe and more mild manic episodes, but these can still be followed by very severe depressive episodes. This type of bipolar is not less severe than bipolar 1. That's a common misconception because of the less intense mania, but it can actually be harder to diagnose because the mania is not as obvious. Cyclothymic bipolar is different from bipolar 1 and 2 as the periods or the cycles, the cycles, can be shorter than the first two types of bipolar. So shorter periods of mania followed by shorter periods of depression. They're both less severe most commonly, but they can be a little more frequent as they're shorter. They don't last as long, so the cycles can repeat more often. In order to be diagnosed by a psychiatrist with this one, the cycles must be prevalent for at least 1 to 2 years in order to establish the pattern and recognize it as cyclothymic bipolar. Like I said, the cycles may occur more regularly, as often as bi-monthly. So the 4th type of bipolar is mixed bipolar, and this one's probably the most unique in my opinion, because the episodes of mania and depression can occur simultaneously. This one can be characterized by sleeplessness, hopelessness, and anxiety, along with intense irritability and antisocial behavior. As the person is affected, they may withdraw from their life. As these two occur simultaneously, the irritability is very high as they're bouncing back and forth on a hour-to-hour, day-to-day basis, so that can be very exhausting for the individual. Suicidal thoughts are very prevalent with this one because there's like so much up and down. So bipolar 1 would be kind of farther apart waves. Mixed bipolar is like up and down, like really, really insane, quick changes. There's no singular cause for bipolar. Commonly, it can be genetic factors or family history. If a family member has bipolar, you may be more likely predisposed to this, or more likely to be diagnosed with it. Although it can also be caused by external factors such as stress caused by maybe the death of a loved one, financial stresses, end of a relationship or divorce, severe life changes essentially. Could be caused by trauma, rape, childhood abuse. All of these things can cause changes in brain chemistry or changes in behavior that could lead to bipolar. And just the general brain makeup can be a factor, such as the function of one's brain, the size, maybe hyperactivation of the amygdala, and different hormone levels within the brain. So there's no cure for bipolar, but there are treatments. It can be treated with a number of different medications. Lithium is a really common one. There are different types of medications prescribed by psychiatrists based on a patient-to-patient basis. There can be antipsychotics, antidepressants, or mood stabilizers prescribed. Regular psychotherapy is also a really good technique for helping to kind of level out the bipolar, as talking can be a form of catharsis. It can be the ability to form connections with a therapist, and it can improve the quality of life quite significantly for someone with bipolar. So this one is a good one to mix with medications. Not a replacement for medications, but definitely increases feelings of hope and just like day-to-day quality of life. More basic ones that can be good for any mental disorder: exercise, meditation, prayer, religion. These can all be a supplement to other treatment, but not a replacement for anything. Medication is definitely the number one treatment. Probably shouldn't be replaced by any of the other, even in combination. Yeah, that's pretty much it. That is the overview of bipolar disorder. It's a very interesting disorder, not as prevalent as people would say in conclusion, but very severe, more severe than I think a lot of people expect. So yeah, if you think you're struggling with bipolar, or you know someone who's struggling with bipolar, definitely reach out to medical professionals or someone who has resources on the disorder. Thank you for your time, and yeah, see you next time.